As previously discussed, in patients with headache and/or craniocervical facial pain, several etiopathogenetic factors are often superposed. To identify such factors, one should proceed with sufficiently extensive and accurate data collection, including history, a psychological assessment, and exhaustive clinical examination. An accurate history must be an absolute priority and should consist of the following details: family and physiological history. Here is an example of a screenshot of a social network. Long-term medical history, recent medical and pharmacological history, data collection of headache characteristics, its location, pain quality and duration, presence of symptoms preceding or accompanying the headache attack, attack frequency and period of presentation, triggering or influencing factor, pain intensity, previous or present treatments. The same information should also be collected for the neck and shoulder pain if present. The presence of symptoms, mainly psychosomatic in nature, should then be investigated. This may provide important information about the presence of psychiatric comorbidity. We ask the patients about the presence of such symptoms using the checklist that you see here. Personal studies have shown that the prevalence of such symptoms in headache patients strongly depends on the presence of a psychiatric comorbidity. As you can see in these histograms reporting the prevalence of psychosomatic symptoms in patients suffering from episodic migraine, chronic migraine, episodic tension type headache, migraine and tension type headache superposed, chronic tension type headache, psychiatric comorbidity substantially increases the amount of psychosomatic symptoms in each group. This is probably one of the mechanisms by which psychiatric comorbidity may negatively condition the natural history of the disease. This semi-structured interview may be accomplished through the social network, making it possible to a certain extent to evaluate the psychological aspect of a patient. If he or she reports depressed mood, additional questions should be asked according to the SCID questionnaire as prescribed in the DSM Psychiatry Manual. Here you have a checklist of these questions, and this is the corresponding screenshot in the social network. Moreover, if a patient reports frequent anxiety, these additional questions can be asked, which allow the detection of the presence of an anxiety disorder. This may appear a bit too schematic, but indeed offers a good preliminary basis to a conversation with the patients that any clinician dealing with patients with chronic headache and facial pain must undergo to reasonably confirm the presence of psychiatric comorbidity. In the next video, we will discuss the clinical examination of the patient.